Welcome back to Breakfast. We've just heard from Paula Bennett, who is keen to instigate drug testing for job seekers and to cut in the dole if they fail their test. So, what do the people who work with drug users every day think? The head of New Zealand Drug Foundation, Ross Bell, is in our Wellington studio. Good morning.
Good morning.
Well, you've heard what Paula Bennett said. She'd like to get this policy into action tomorrow, if she could. What is your perspective on it?
Well, it's really pleasing to see the Minister putting some more detail on the table. This policy comes out of the Welfare Working Group report, and that report was actually very draconian. It was quite a horrid report, and we were very critical of that at the time. And quite recently, we've had Bill English saying, we're going to drug test everyone on benefits. Well, now we've got the Minister saying, well, no, this is what it's going to look like. And so some of our concerns that we had earlier on, I think, are beginning to be addressed. And those are around what do you do with people who fail a test but who are shown to have a drug dependency problem? What kind of support are we going to give them? The earlier report said that they're going to start cutting benefits of those people. So, I think if we can identify people who need help and get those people help, then that's a fantastic thing. One of the challenges, of course, is we all know that our treatment services are already very busy. There's waiting lists, and so we're going to need to see more investment into that as well.
Well, this is a difficulty because Paula Bennett was quite honest. She said, yes, she wants to see people into work, but it's also about getting people off the benefit, as in saving money. I would suggest that treating people on drug addictions is an expensive business.
It's an expense, of course, initially, but it's a great investment. For every dollar that you put into treatment, you save $7 elsewhere in social and health and other costs.
So are you confident that are you confident that the government is interested and willing to make that kind of investment?
Well, if we see other things that the government has done in this area, they've invested $25 million into methamphetamine treatment, for example. They're putting money into drug courts, and so I think they are beginning to put their money where their mouth is. But I think we are going to need to see a significant investment to support people who do have drug dependency. And then I think we need to get a bit more realistic about what we call recreational drug users. So if people are failing these tests, then what are we going to do with them? And that might be a good opportunity to start talking to people who use drugs recreationally about their drug use, about the health consequences, and about ways that they might be able to cut down or stop.
Ross, from your experience, is a move like this saying we're going to cut your benefit if you're using drugs likely to decrease the number of people using illicit drugs?
I think that's going to be a real challenge because in this country, sadly, we have high rates of drug use. It seems to be part of our culture. So there's a bigger issue here about how we get messages to people about drugs, about how not to use, how to cut down and how to stop. And that's a bigger problem across society rather than just with people on welfare.
All right, Ross Bell, thank you very much. New Zealand Drug Foundation. We could chat for ages, but it is 7:30.